remove the airway, turn the patient's head to the side. And I assume they need suctioning, and that's what you should assume. Turn your suction on, and then test your suction, again with gloved hands. And then insert the yonker wherever you see the vomit, and then cover the end of the hole, suction, suction, side to side on the way out, no longer than 10 seconds. Turn your suction off, clear your suction tubing, and turn the head to the open airway position. They'll tell you, okay, now your patient is now snoring and needs further airway. So I'm going to select an NPA now and measure that from the tip of the earlobe to the tip of the nose, checking the diameter to make sure it's going to completely fill an area without distending it. And then I'm going to select the beveled side, so I'm going to insert the bevel towards the septum.
You gonna lubricate that?
It's lubricated already with water-soluble gel, but very good catch. Try not to do that anymore, though. Let me miss a question. Let me miss something if I need to.
Oh, okay.
Okay? Because you can't do that in a real test. All right. So the NPA is in. I'm done with this station. I would have missed that point.
Oh.
All right.
It's just a point.
We're going to find that out in just a second. That's the whole reason why he's doing the critical criteria. You got the critical criteria there. Read aloud. And say whether I did or didn't do it.
You want to read these?
Yes.
Did not take or verbalize body substance isolation precautions. You did that. Did not obtain a patent airway with the oropharyngeal airway. You did that. Did not obtain a patent airway with the nasopharyngeal airway. You did that. Did not demonstrate an acceptable suction technique. You didn't do that.
I suctioned appropriately.
Yeah. And inserted any adjunct in a manner dangerous to the patient.
Okay. So I didn't mess that up.
You did not miss any critical criteria.
All right. So what do you think my chances are of having passed the station?
You passed it.
All right. They're very good. They're about 99% of the chance. So, was it you? Go ahead and go through all the point values.
Takes or verbalizes body substance isolation precautions. Got it. Selects appropriately sized airway. Got it. Measures airway. Got it. Inserts airway without pushing the tongue posteriorly. I think you did that.
Okay.
Removes the oropharyngeal airway. Got it. Turns on or prepares suction device. Yes. Assures presence of mechanical suction. Yes. Inserts the suction tip without suction. Yes. Applies suction to the oropharynx, nasopharynx. Get the nasopharynx.
I did not do the nasal. I only did the oral pharynx.
So half of that.
You don't get half points.
All right. Selects appropriately sized airway. Got it. Measures airway. Got it. Verbalizes lubrication of the nasal airway.
Ah.
Didn't get it.
Didn't get it.
Fully inserts the airway with the bevel facing toward the septum. Got it.
Okay.
So.
All right. So even though I've done this 1,000 times and demonstrated another 7,000 times, I didn't lubricate that verbally. It was already lubricated. But I missed that point. Now, am I really worried about that? Because I didn't miss any critical criteria.
Didn't miss any critical criteria, however, I don't remember seeing you check suction.
I did.
Yeah.
I did see that.
Oh, yeah, you did.
Yeah, back to you, kind of when you
I
were
did.
doing it.
And it's really another point that has to be made. These evaluators are not unlike us. And sometimes, especially if they've been through about 7 or 8 before you, sometimes they're just tired. They've just got off a shift. You know, for a variety of reasons, they may miss some things. So that's why you want to be very methodical and demonstrative, especially when it comes to the critical criteria stuff, right? So when we get to the AED, for example, when it comes time to clear, I want your arm waving and saying, I'm clear, you're clear, we're all clear, clear, right? And making sure that that is extremely demonstrative. When you're saying the oxygen, or anything else that's a critical criteria, I want you to do something to make sure they don't do what he just did, which is a normal thing to have happen. It happens from time to time. All right, so That's the best you can do. If it's a two-person evaluation team, that sort of thing can be checked on with each other. You'll have two-person teams in the AED and in the trauma patient assessments, and the medical assessments also. So some of the others are a one-man evaluation team, and those kinds of things can happen from time to time. So you want to make sure that you are demonstrative on those things that are on the critical criteria list. Be sure they can't mess that up. All right? So we have it all the time, even on the paramedic exam. People come and complain, I did this and that and the other thing, and they just didn't give me credit for it. Well, they might have, might not have. Sometimes you think about it and didn't do it. Or sometimes you thought it in your mind and didn't say it, or whatever. So just because this thing is slicker and greased, whatever, doesn't mean you can not now say, move it up. You're absolutely right. You just caught on quicker than I needed you to.
Can you show us how we're supposed to, how long and how we're supposed to suction the nose?
That's a test
Well,
question.
you're not going to be suctioning the nose. You're going to be suctioning.
Thank you, sir. I was asking him, but thanks.
You're going to be suctioning the oropharynx with a yunker.
Yeah.
The suction time would be no different if you were doing nasopharyngeal.
It says to suction the naso also.
Well, please don't stick this yunker up their nose.
Just on the outside.
Just on just the outsides of it.
If you want to do that, I guess it's okay.
I mean, it's just on here. That's why.
What does it say out loud? I don't have my thing.
Apply suction to oropharynx and nasopharynx.
It says and?
Oh, slash.
No. It says slash. That is not an and sign.